everyone. Welcome to The Zest, the official podcast of Orange Coast Magazine. I'm Chelsea Ranieri, and you may recognize today's guest from the popular shows Botched and The Real Housewives of Beverly Hills. He is a double board certified, world-renowned facial plastic and reconstructive surgeon who is a pioneer and leader in the field of aging face plastic surgery. He has an award-winning skincare line called NassifMD that is often featured on Good Morning America, The View, Home Shopping, and of course, NassifMDskincare.com. Thank you so much for being here today, Dr. Paul Nassif.
Well, Chelsea, it's great to be here, and it's great to be, you ready for this, everyone? A permanent resident of OC.
Yay! I love that. Welcome. We're so happy to have you.
Yeah, that view is a little bit different than LA.
Yeah, it's... that's an incredible view. I'm very jealous. Well, I would love to start from the very beginning of your story. And you actually grew up in LA. What was your childhood like?
Pretty standard for kids being raised back then. Very different than I raised my kids now. Basically, I grew up in Hollywood, area called Los Feliz, and I went to elementary, high school, stayed in college, everything in LA. And I had, hardworking parents. They all worked. I started working very, very young at the age, probably, even started around 14.
Wow.
I started working young. And I always kind of wanted from selling sunflower seeds door to door to selling chocolate, to working at Baskin Robbins. I did everything. I used to even at the age of 9, I set out on the summers in Boston, where my mom was from. I'd sell rocks on a little TV tray.
That's so cute.
From the ocean. Go down and find nice rocks from the ocean, bring them back. So it started early. So I had a typical brother and a sister. I had a nice upbringing. And we worked hard. Back then it was a lot different than it is now.
I bet. Well, what did your parents do when you were growing up?
My father had a little carpet store, Oriental rugs and wall-to-wall carpet. And I used to go help him and go there after school. And I'd sell actually the small little carpets in front of your door. I'd sit out in front and do that to make extra money. And my mom was a part-time interior decorator.
Oh, nice. Wow. So you were a hard worker from like day one.
Yeah. And I feel like that was really important, and that's something that, again, back then, we would actually ride our bikes. My school was maybe 3 miles away, to school. And back then it was no big deal. You ride a bike, or, a skateboard.
Yeah.
So very different.
You couldn't get me to bike 3 miles today. So that's impressive as a kid. Well, you went to Loyola High School and later USC for a degree in business. So why did you initially choose that major?
So back then, I knew I wanted to go to medical school, so I was pre-med. But then I said, because business is my thing. I love business. I was in the restaurant business. When I was in college, actually, and high school, I was working in the restaurant. But I was a manager on a restaurant on the Sunset Strip in West Hollywood, across from the famous Spagos and everything. And I worked there 3 nights a week. And so I've always loved the restaurant and business. So I said, okay, can I get a business degree, which could help me in future in life, and still do pre-med rather than go in the bio or chemistry or physics route? And back then, no one did that much, but I just said, let me take a chance and do it.
So smart. And you were initially on the path to be an ENT, is that right?
Yeah. So no, I'm trained.
Oh, wow.
Yeah. So I'm originally an otolaryngologist, even though I never really practiced it per se, except for the nose and the anatomy of the face. But so everyone will know, maybe a lot of you won't know this. So what's the difference between a facial plastic surgeon and regular plastic surgeon?
Yeah.
So plastic surgeons they usually train and do general surgery. And then they do a residency in plastic surgery. Mm-hmm. And that includes, all kinds of things, reconstruction, burn, hand surgery, trauma, cosmetic, aesthetic surgery, everything. And otolaryngology, which I loved because of the head and neck anatomy. I originally trained, who got me interested in this was a famous doctor named Dr. Howard House from the House Ear Institute in downtown LA. and I was going to be what we call a neuro-otologist. That is a subspecialty under otolaryngology, where you're working on the ear, but skull base with the neurosurgeons, tumors that involve back towards the brain that connect to the
Wow.
ear. And it's all microscopic work. And I was going to do that. And because part of otolaryngology is one, that had a neck surgery, like for cancers or masses in the face and the neck, sinus surgery, rhinology, nose surgery, facial plastic surgery, allergies, pediatric ENT, or nose and throat, all that. And then I fell in love during my third year with facial plastic surgery, especially facelifts and rhinoplasties. And as a matter of fact, when I was going to the University of New Mexico in Albuquerque for my residency in ENT, I'm probably the only guy, probably in the history of maybe of any ENT program, that had a private practice my last 6 months of my residency in facial plastics, where I had patients coming in for facelifts and brow lifts and eyes.
Wow, that's so impressive. What an interesting career path. I didn't know about these different specialties. That's so interesting.
Well, it's a little bit of 111 so everyone would kind of know about it.
Yeah. What made you fall in love with the facial plastic surgery portion of it?
So I went and did, we had a guy who was doing facial plastics, and I started loving it. But then what put me over the edge is this little young boy, maybe 6, 7 years old. He came in one day when we were on trauma call, trauma of the face. And he had multiple dog bites to the face and scalp.
Oh, no.
And body.
Oh, my God.
And I was on the team to help put him back together. And this little boy, sweetest personality, always wonderful, always blow me a little kiss at the age of 6.
Oh.
And the sweetest kid. And we did a lot of work over months and months and made him pretty much back to whole. And it just said, okay, I'm in. That was it.
Yeah. Wow. Wow. What an incredible story. Well, given your extensive experience in facial plastic surgery, how have you seen the field evolve over the years, particularly when it comes to face and neck lifts?
Well, what's interesting about that, I've been doing this for 25 years, and
Wow.
And somebody called the deep plane facelift was around, many years ago. As a matter of fact, when I was finishing my residency, I went to Texas and saw one of the original guys that did this thing called a composite facelift. And so there's been different facelifts, and there still is different facelifts, many.
Oh.
There's all different types of techniques for facelifts and eyes and brow lifts and everything else, And so what's happened basically after seeing over these years, going to different meetings, talking to my colleagues all over the world. For example, I'm on a WhatsApp chat for super neckers, it's called, for about 50 doctors across the world.
Wow.
For, problematic issues and new procedures. And so, the aspect is in that realm, there's the technology has changed because there's different instruments and tools to make the procedure more effective and more safe. But no matter what, it still comes down to the doctor's technique.
Yeah.
And again, there's 15 different techniques. The hands, the skill set, taking your time to do this. And, it's something where there's also been minimally invasive procedures to help tighten the skin, especially if you're a little bit younger. And then there's the lifts, more of the minis that we started doing when patients don't look like they need an emergency facelift. So we started doing, have different ways of learning how to do smaller incision lifts. So maybe if you're in your early 40s, you might need this versus the whole thing. Or is it just this part? Or is it just the neck? Or is it just a little bit of fat? Or is it a little upper eyelid skin? And so technology, different techniques coming in full circle, perfecting different techniques, and the newest aspect about this, but maybe it's coming back. It's called deep neck surgery. And
Oh.
it's kind of the highest level of difficulty where you're actually contouring some of the deep neck contents. And there's more risk, more
Mhm.
healing, but that's how you get that snatched neck.
Yeah. Ooh, well, is there like, so you said like your early 40s, is there an age where you feel like you should start considering, or maybe start considering these things? Or is there an age where it's like, you're just too young to even consider this?
Well, the first thing I tell everyone is start skincare early
Mhm.
because no
Yeah.
matter what, your skin, if you do a neck lift and you're in a facelift and your skin looks horrible, it just doesn't look good. So you want to
Yeah.
start taking care of your skin, even at the age of 20s on up. You know,
Yeah.
my teenagers are taking care of their skin now. So I
Good
get
for
them all into a
them.
routine. Yeah. Simple routines. Simple,
Yeah.
then you go up. Like my detox pads and things called hydroscreen. But anyway, and then as you start getting into whether it's a little bit of Botox, when you start
Mhm.
getting a little older, versus if you start seeing a little bit of
Mhm.
elasticity changes, you start doing some minimally, like we have a soft wave technology, it's ultrasound of the skin. We start doing gentle things to keep the skin tight. And then
Yeah.
depending on the genetics and lifestyle, you might be 38 and need a little mini lift. You might be
Right.
44. So it's all different depending on the patient and the exam.
Got
And
it.
if you see me on Botched, there's many times I say, nope, you're not a candidate.
Yeah, right. That makes so much sense. Well, can you talk about some of your more unique surgery techniques?
Well, since we're talking about the face,
Mhm.
what I'm using and a few friends of mine from Europe
Ooh.
have taught me, it's actually going to be, I'm coining my own term, lattice lift, but it is a deep plane facelift where we're using, sutures for about 3 days. That go through the skin all the way deep. And it's like a big lattice network throughout your whole face to help decrease swelling and collection of blood or fluid under the skin, which is a risk of having the surgery. And so you can do this by doing the same techniques, but making the incisions a little bit smaller. And it looks pretty graphic.
Oh,
And matter of
yeah.
fact, we can give you a little close-up photo if you want to see what it looks like. Make sure you
Yeah, I would
just,
love that.
we'll have the office get that. So it's called the lattice lift. So it is pretty interesting looking from the outside because you're seeing, it's like you're putting sutures all the way through your skin. This netting.
Wow.
It's like a netting of stitches.
Yeah. Does that take longer to do?
Yeah, it adds about a half an hour to the
Oh,
facelift when you're doing this, but it really helps. Um,
yeah.
and you can use that to do different techniques with small incisions for the brow lifts. We still love doing a combination of something called nano fat after every facial procedure, in addition to some fat grafting. So what does that mean? So let's say I'm doing a little temporal brow lift, doing a little eye lift, taking the fat in the lower eyes. I'm giving you the basics. And
Yeah.
we reposition the fat rather than removing it. We take that fat and move it into the hollow area.
Oh,
Because if you take out
wow.
the fat, you can get hollow, period. And
Right.
then we take a little fat from the belly and we add a little fat, whether it's here, here,
Uh-huh.
here, 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 earlobe, deflated earlobes.
Whoa.
And then we take the other fat that's left over, and we emulsify it to get the cells. They're called multipotent stromal cells. And
Uh-huh.
we inject that into just the dermis, just below the skin level, into the skin for those cells to help improve pigmentation, discoloration, and texture, to improve texture. So,
Oh my God.
we try to do all these together, or a subset of these when we're doing these face surgeries. And that's, listen, when someone says they created something, maybe a different technique or a
Mhm.
portion of it, but a lot of procedures have been around, maybe described originally 60, 70, 80 years ago. Then it comes back and you modify something. The biggest thing that's coming back in play that I love doing is lip lifts.
Well, oh, I've never heard of that.
So the lip lift, if you have too much distance, bottom of your nose to your upper lip, called the vermilion border, and if your
Uh-huh.
lip doesn't have a lot of red show, You're taking a wedge of skin from underneath.
Uh-huh.
And by the way, we have some great she can get you a photo before and after if you want.
Yeah.
Taking a wedge here and lifting up that so you shorten the distance of that lip, but it gives you more lip flip. You see more of your red lip.
Whoa. That's amazing. I've only heard of the lip flip with the Botox. That's cool. You can do it surgically.
Yes.
Wow. Well, you've started on the show Botched, as we've mentioned before, since 2014, which currently is at 8 seasons. So how did the show first come about?
Well, interesting. So basically, I was sitting with the executive producers of the Housewives, the Beverly Hills, after
Mm.
we were off that show and after, shortly after my divorce. And I said, hey, it's time to do the plastic surgery show. And we were both talking. I said, why don't we do life-changing stories that help people and also
Yeah.
educate of what not to do and what to do? Let's take patients that have been messed up, you know,
Hmm.
uh, and fix them on TV and show the complications and the problems and all the issues that come up and show really how it is. Because, it's not all fun and games,
Yeah, right.
until you have complications. And and then from that, it evolved into doing those for patients that never thought they can get helped or didn't know
Mhm.
there are doctors that can do it or couldn't afford it. And at the beginning of the show, when the casting crew, they had, so E picked it up immediately and we did 8 episodes for the season 1. And actually, Botch trended on Twitter the first day when it launched.
No way.
It trended. And people used to have botched parties. They'd have a
I'd
party come
love
over and
that.
they'd watch it. And, we'd have a few patients that would come in or the casting department would have a hard time, maybe they think they got 300 people to apply the first time. And we had to pick patients out of that we could help. And most of the time when we're looking at these patients, it was no, 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 yes. It was just too
Uh,
difficult.
yeah.
And then as time progressed, as what it did, it took my surgical skill set of the hardest cases probably in the world and brought it up. And now it's, yes, 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 no.
Wow.
And so we did that. And then we started bringing these patients that are more obviously entertaining and crazy stories.
Yeah.
But at the same point, even though they're crazy stories, there's an educational aspect to it of, hey, do this because here's what can happen.
Right. So true. I love the show so much. So I love hearing all of that. Well, what have been some of your more memorable moments for you on the show?
Um, let's take 2, just right,
Okay.
because I can go through them. Many years ago, there was a patient, I think Lucy Di Prima, young lady who was riding a moped in Italy and got into an accident and kind of hit her face on some wall.
Oh.
And she had reconstruction of the nose by somebody, did a good job, but she needed more. So when she came to see us, and she was from Boston, she complained of this, clear fluid sometimes coming out of her nose. So my mind, we're thinking, okay, we need a CT scan to look to make sure she doesn't have a leak of brain fluid through her nose. Trauma,
Oh no.
because there was one side that was clear. And so we did the CT scan, and that CT scan showed a couple aneurysms in her brain.
Oh my God.
These are blood vessels that once they pop anytime, a little strain, you're dead, pretty much. You
Oh
die.
wow.
And so we found these, diagnosed it. She went and had surgery. Doctor did a wonderful job fixing her. She came back. We did her nose, so we saved her life. She did her nose, and she didn't want to leave the house with her nose before. And she had a severely autistic
Oh
daughter.
no. Yeah.
And she wouldn't do much with her daughter.
Oh.
She wouldn't go out because of her nose. She wouldn't take her to the park, wouldn't do anything. So we did her, and it changed her life and changed her daughter's life. And she brought her daughter to the That's the only time ever that I was there for a reveal. And I met her
Oh,
daughter, and
wow.
her daughter, was so thankful, and of course, very autistic. And that was, you know, it helps you. It's wonderful.
Yeah. And you
And
saved
I
her life.
and I recently heard, I think a year or so ago, that Lucy passed away. She died.
Oh, no. Oh, my God. How sad.
I don't know what from, but still to this day, it gets me because I have kids.
Yeah.
And once you have kids, you become very sensitive. So
Yeah.
excuse that for a minute there. But now listen, you see me, I've cried, I don't know how many times on Botched. It gets you. And then just recently, our last episode
Mhm.
on Botched on season 8. Yeah, if you haven't seen it, you need to pull it up. It's the
Yeah.
last episode of the year. It's a lady from Mexico City or somewhere in Mexico. Who had a tumor this big on her face, huge tumor.
Oh,
And we did life-changing procedure at Sharp Hospital in San Diego. We did it with them. My friends and CEO were there, and they donated everything from their standpoint. And we did it's a wonderful hospital system, and we changed her life. Took off this gigantic tumor on her face.
wow.
So these, there's so many, so
Yeah.
many things, but those are the two bigs that kind of resonate with me more.
Wow. What a rewarding feeling that must be, especially 8 seasons of that. That's incredible. Well, tell me a bit about some of the stuff that you're offering in Orange County.
The same surgery that we do in Beverly Hills.
Wow.
Noses and facelifts and eyes and brows, and especially, this lattice lift. And especially we have I already have a lot of patients from whether it's the Riverside, Palm Desert, Inland, 909 area,
Yeah.
San Diego County, Orange County. And so, and now, and plus we moved. So even though I'm part-time at Beverly Hills, and then a couple times a week I'm out here. So it brings me closer to my family. And I'm out here in this incredible, area.
Yeah, I love that. What what are some of the treatments that you offer? I didn't realize that you can do pre and post surgery treatments.
Oh yeah, you got to get the skin ready. That's
Yeah.
why, like, if you ever watch me on Home Shopping Network, I'm talking about pre and post op skincare.
Mhm.
Must. You got to get the skin hydrated, ready to go. And we do that for about a month before surgery. In surgery,
Oh.
too, we'll do a lot of lasers for texture, fine lines, pigmentation in surgery. We do hyperbaric oxygen treatments before and after. We do hydrofacials with I have a NassifMD booster, hydroglucan, to get the skin ready. And we do red light. We do IV therapy. We do everything pre and post op, ultrasound to pretty much get you ready to heal faster and then to heal faster after surgery.
Oh my God, that sounds incredible. Well, speaking of the non-surgical treatments that you do, there's just so many to choose from. There's laser therapies, microneedling, PRP. How can people decide which one's right for them?
Well, first, it's always good to listen to your trusted medical provider.
Mhm.
Always be careful what you read on social media. Okay.
Yeah.
You never just say, oh, yeah, I want to do that. You always got to look into it because of the risks. Whether it's laser, microneedling, PRP, the nano fat,
Mhm.
there's all different types of treatments that you can do. And, the thing that I'm always worried about now is fillers. Fillers can have
Oh.
we're finding out fillers could actually maybe do a little bit more. You got to be careful. You can't really overdo it. Fillers
Mm.
can spread in your face. There are risks with fillers, bad risks. And also, when you go in there and try to reverse some of the filler, if you overdo it, that could actually take care of or remove some of your natural hyaluronic acid. So you have to be careful.
Oh,
Now,
that's good to
I'm
know.
going to give me 1 minute. I think I need to
Yeah.
shut this a little bit. It's a little bit chilly here.
Oh,
I'll do
perfect.
that.
Yeah.
Let's see. Does that
Well,
make sense?
that totally makes sense because I hear all these things where it's about like face balancing and all these things. I'm
Yeah.
like, do it all to me. But I'm so
Yeah.
scared. But yeah, that makes so much sense to not listen to social media. I need to do more of that. Well, as we've mentioned, you've developed a line of products, NassifMD Skincare, which focuses on high quality ingredients to tackle 4 key markers of healthy, youthful skin, including
Yes.
hydration, even skin tone, smooth texture, and firmness.
Almost.
So, why did you start this line and what are some of your hero products?
Okay, so first of all, I have a unique perspective as a facial plastic
Yeah.
surgeon because I'm seeing the skin from the inside out. And I can actually see when it's dehydrated. And from the technical aspect, 2 analogies. One, if I'm doing a facelift and I'll be graphic, I'm peeling back the skin to expose
Yeah.
the deeper layer, the deep plane. You know, um, and if the skin is dehydrated, it's like trying to peel the skin off a raisin.
Oh,
My
no.
goal is to hydrate this case. I mean, my goal is to hydrate the skin.
Yeah.
And that's what our Hydro Screen, everyone has been using that for at least 4 weeks prior to surgery. And then prepping the skin from the cleansing, exfoliation, detoxifying. It's like our detox pads. Those are our main 2-year-old products to prep the skin before surgery. And, so we're getting the skin to become like a beautiful, luscious grape that's moist.
Yeah.
Remember how you peel off the skin off a grape? It's easy. Kind of same thing.
Yeah.
You can't do that with their raising. Or if you're a seamstress, or you are a clothing designer and you're trying to carve around a piece of cardboard versus a beautiful piece of silk.
Right.
Think of the same analogy, So the goal is to make it more pliable, hydrated, and it gives you better outcomes during surgery. And actually, the skin and your results look better when your neck, because your neck doesn't heal well. You have to be careful of how
Oh,
you treat the neck because it doesn't have a lot of these epithelial cells. And so if you can start treating your neck beforehand, like with my Deco lift and the Hydro Screen and detox pads, your goal will be when you do your neck lift, I'm tightening the muscles, helping the skin get in that snatch look, but the firmness, the skin tone, hydration. If you do all of it of your face and neck, then your results look better. And so,
right.
and so my love really for science and ingredients, it's more of a natural path forward. It just dovetails into what I do.
Definitely. Well, we're all aware that the sun ages us, but are there some lesser known aging factors?
Oh,
Mm.
let's see. That's good. Genetics, diet,
Oh,
lifestyle, not sleep, stress, all that, you know. Um, there's actually, you know, blue light sometimes can actually, even being on the computers and stuff can
really?
actually cause problems with collagen elasticity. And of course, smoking.
Right.
Infrared can maybe even do a little damage to the skin. So blue light, infrared, all these things, smoking, sun, of course, as we know, the UV rays. And a lot of it, though, is genetics, too.
Yeah. Oh, I already know I'm going to have to get an eye lift. Well, quick side story. So I had Botox in my master's for TMJ, and the person said she'd done it a million times. There were absolutely like nothing to worry about, no consequences to it. And she injected 30 units on each side. I became like gaunt looking and my smile got messed up on one side. Come to find out, I was only the 10th person that she did it on. So, how can listeners be sure that they're picking the right med spa or the right doctor when people kind of zhuzh it up like that?
Well, first of all, complications with Botox can happen with any,
Okay.
experience or non-experience. It could happen. The person you went to might have done beautiful, maybe a little bit too much in the beginning,
Yeah.
maybe a little bit aggressive. But I was certain maybe with 15. But the point is,
Yeah.
you have to make sure they know the anatomy very well and
Mhm.
going into that muscle right here. Because if you go maybe a little too superficial, it could spread to many of the muscles because the muscles from here go up from the platysma, and there's 4 muscles right here which control the lower lip.
Oh, wow.
There's and if that kind of heads over towards some of the nerves that
Uh-huh.
derive go up to that, area, they get into the muscles, it can cause problems. It is a risk when we do master injections. And you're right, you
Mm,
have to have the right needle, the long enough needle, and be able to go into the muscle bed. So the best thing to do is, you just have to find experience. Listen, there's a lot of great nurse injectors,
mhm.
physicians assistants, nurse practitioners, doctors, plastic surgeons, derms, everyone that is doing Botox.
Yeah.
And you know, it's it's something as long as they have a lot of experience and they just, you know, been doing it for a while. It's fillers
Yeah.
you have to be. Remember, once that happens, at least it goes away. Fillers is what
Right.
you have to be more careful about. Fillers.
Okay, good to know. Thankfully I haven't tried that one yet, but that's good to keep in the back of my mind. Well, I've also been seeing this trend on TikTok called lunchtime lipo, and I saw an article where you talked about how this is kind of a gimmick. So, can you explain why that is?
Well, that's right. You had that link that I did when I was in Dubai. Listen, I mean, there really is no lunchtime lipo. You're not going back to work.
Yeah.
I mean, maybe, what they do is they do it under local. And again, depending on, again, who's doing it. But if you're under local anesthesia, which is fine, tumescent, dermatologists actually created that. But
Oh.
it's a real procedure. You have to be careful. That's just a term. You know, Anytime you have lipo, you have to be treated in the right facility, the right sterile equipment, the right technique. So, because you can have a lot of damages, you have a lot of problems in terms of
Yeah.
lipo. Besides the soft tissue irregularities, you could actually puncture some vital organs. So,
Oh,
you have to be
wow.
very careful when you do lipo. So, the bottom line is you just want to make sure you go to an experienced lipo specialist.
Yeah, that's good to know. Yeah, lunchtime lipo sounded like kind of like a med spa situation where you just go get it done and then you go back to work type of thing.
Yeah.
Well, are there any other trends that you've been seeing that you would like to debunk?
Uh, let's see. Trends. I mean, I'm trying to think on that one. Listen, I know on TikTok there's a lot of trends.
Mm-hmm.
And so I don't really watch it. So I don't know. But
Right.
all I'm going to tell you, if you see a trend, okay, let's talk about buccal fat removal real quick.
Oh, yes,
Trend.
that's a big one.
Companies are doing that. So now, if you're someone who genetically has huge buccal fat pads, maybe
Uh-huh.
you're the right candidate. Let's say someone like you, Chelsea. If you go
Uh-huh.
in because this celebrity did it and you want to get this taken out, you'll be slow for a few weeks. You're going to age. Sourness of the face makes you look older. As we get older, we lose subcutaneous fat. It might look good at a year, but then in 2, 3 years, you're going to be going,
Oh,
like
no.
that. So you're going to be careful.
Yeah. And that's not reversible, right?
Well, you can maybe try to have some fat in there, but it's really too hard. It's not a great
Oh,
area.
yeah. Okay, good to know. Well, is there anything that you would like listeners to keep an eye out for in 2025?
Let's see. Okay, let me, to keep an eye on 25. Well, maybe, let's see, about, whether it's, social media, internet
Mhm.
shows, you know, the biggest thing is we need, to have skincare. I mean, to
Yeah.
me, taking care of your skin, um, you know, I'm just thinking in general, I want everyone to kind of say, okay, in January 1, you have these new things you're going to do for your life.
Mhm.
Um, I'm going to say exfoliation of your skin and hydration. I'm going to talk about skincare.
Yeah.
And, our detox pads, that clean and exfoliate, their anti-aging products. That together with my Hydro Screen. And it's a
Okay.
hybrid serum which hydrates and moisturizes and has a little bit of retinol. That
Ooh.
really, and by the way, the detox pads make all your skincare work better. So number one, skincare, detox pads, Hydro Screen from NassifMD. Okay.
Yeah.
Sunscreen. So you really should never leave home without sunscreen, even if it's completely overcast. You got the
Mm.
UV rays, and we have a protect and hydrate mineral SPF. It also has vitamin C in it, so it's anti-aging to brighten your skin, protect the skin, lightweight, and the texture is really great. And it has a little bit of a light tint on it too. And so, if anything, I'm just talking about skincare for 2025.
Yeah.
Take care of your skin and start early.
Perfect. Well, we are coming to the end of our time, but before I let you go, I have three final questions for you that we call the thoughtful three. So you actually answered my first one. I was going to ask if you could pick three key products, what would they be to
Oh,
incorporate into your care routine? So your
actually,
SPF.
I just did it.
Yeah.
Yes.
Yeah. So perfect. Yeah. Well, then second,
Oh, no.
what moments in your career have had the most significant impact on who you are today?
I think in general,
Hmm.
it's, I have a fellowship, which means I have one ENT, otolaryngologist that wants to go to facial plastic surgery. We have one or two of them a year.
Oh,
And
cool.
teaching for the last 15 years, teaching these fellows, um, and keeping up on things and learning and all that, has made a significant impact in my career. And I've been fortunate to have this fellowship. Two, I think being on Botched, of
Hmm.
taking my skill sets, my armamentarium of different types of procedures. And I've always been a revision specialist, but it took me from being a revision person here and going way up here. And
Yeah.
actually, my mom pretty much put
Oh,
maybe where I am today. I lost her in
oh, I'm so
2002.
sorry.
God rest her soul. And I think about her every day. But
Mhm.
her in my life and me keep always hearing her in my voice saying, in my head, don't, you always do the best you can and work hard. Nothing comes easy in life. These are the things, and of course now having, I'm blessed. I have three wonderful, healthy boys from my first marriage. And then with Brittany, I have baby Paulina, who's 4, and baby Paul
Oh,
Jr., who's 7 weeks old. So
oh my
listen,
gosh.
I'm
Congratulations.
starting away all over. I'm like really blessed. Dad
Yeah.
all over again.
Oh, I love that. Well, lastly, what is a habit or routine that you feel has helped you become successful?
Always be early to whatever you do.
Ooh, okay. I love that.
And never say, I'm doing the best I can when you're at work. You always try to go far and beyond what you're capable of doing. And always don't give up until you feel like you've given it really your best, no matter what it is.
I love that. Well, thank you so much for doing this. I had so much fun getting to talk with you. I learned so much. And I'm so excited for our listeners to get to hear this.
Well, listen, I want to say thank you so much. It's great meeting you. And I look forward to seeing you guys.
Yeah, of course.